everybody, and welcome back to our chat today. So this is quite a chat that a lot of people have been wanting to watch, which I'm really thrilled to say. Now, please understand that all of my questions and things that I talk about on Facebook or on any of my interview platforms are always things that have been sparked by somebody who's asked me a question. So it'll be a vet or a client, or somebody has mentioned something to make me think about, why we're going to talk about this. So the reason why I'm saying that is because obviously hydro versus physio might sound like a bit of a fighting talk, and that is not what this is about. Okay, this is not fighting talk. This is not about anyone bashing anybody. This is just that once when I was doing one of my cup of tea with the vets, one of the vets said that hydro and physio were the same. Didn't even ask me a question. They just said a statement. They're the same, and I was like, no, they're not. I don't have a pool, and I'm still perfectly good at my job. I don't really understand. I was completely confused that a vet had said that they were the same. So I decided, who can I speak to? Who can I get to help me get this across? Because obviously it is something that people need to know. So I reached out and spoke to Caroline. Now, Caroline, I have known for a long time. And she is a little superstar, and she loves learning, and she's amazing. So basically she started out, she's going to introduce herself, but I get excited, so I'm just going to do a little intro there, Caroline, and you'll get a word in soon, I promise.
Right, don't worry, sweetheart, don't worry.
So Caroline runs CS Hydro Physio now. That's her company, and she's based in Reading, so down the road from me, hence I know her. And she started out as a hydrotherapist, and then she came and saw some practice with me yonks and yonks of years ago, and decided that she wanted to be a physio. So she then updated and upgraded and decided to do her physio training. And I can use that word upgraded because it was a lot harder, and she will explain that all. And now she's absolutely bonkers because she does always like to do so much. Am I allowed to say what you're doing next? I won't say. Caroline, you can introduce yourself now and tell everybody what you're doing now, because she's bonkers.
Yes, I'm Caroline, and yes, I've known Donna for absolutely years, long time, grey hairs, and definitely long time. So yeah, I started as a hydrotherapist back in the year dot. Then I qualified as a vet physio, as Donna was saying, and now I've just completed year one of a 4-year study for human osteo, with a plan to be in at the end of it to do the animal osteo, but I've got to do the 4-year human before I can do the animal bit. So nuts. Yeah, I'll go nuts.
You are nuts. You're absolutely insane. See what I mean, guys? Isn't she a superstar? So basically, I thought the best way for me to handle this question was not to talk about it myself, because that would be biased, because obviously I'm a physio. So I thought I'll pull in somebody who is both, and she can talk frankly and honestly about both. But let's remember, I cannot say this enough. I love hydrotherapy. I work strongly with a lot of hydrotherapists. This is not about hydro bashing or physio bashing. This is just about understanding. So if you guys have any questions, please do come and ask as well, because this is great. So Caroline, go for it. Tell us, what is the difference between hydrotherapy and physiotherapy?
Me personally, I think it's quite simple. One's in water, one's on land.
There you go.
That's simple as it is. Hydrotherapy is basically a non-weight bearing exercise that you can exercise in the water, nice warm water, to encourage circulation, and totally non-weight bearing. Simple as.
There you go. So I think this is, where we need to sort of talk and diverge a little bit. So when you go to a lot of hydrotherapists, I've been and visited quite a few pools and stuff, and what I do see is that there are differences of equipment, differences of things available. Absolutely. And stuff like that. And I think that's where the grey area ends up, and this is why some confusion ends up, because you may well find, I have gone to hydrotherapy pools before where I've seen there's been a laser, and equally you can then go to a physio place and there's a laser, but equally you go to the vets and sometimes there's a laser. That doesn't mean that the vet was doing the same as the physio or the hydrotherapist. It just means that sometimes there is an overlap in equipment and knowledge.
Yeah, I think you're right. I think there's a lot of overlap between physio and hydro, but predominantly the hydro should be in water. Any exercise that's done in water should be classed as hydro. Anything on land, as in not wet, is physio.
Absolutely.
But even in the centres, you're quite right. Some places have got a treadmill, some places have got a pool. But the bottom line is, if you're doing something in water, it is hydro. Simple as.
Absolutely.
Simple as.
There you go. I mean, I like the keeping it simple thing. That is brilliant. And so, you know, it really helps because it helps owners to have an expectation that basically if you go to hydrotherapy, your dog will come out wet.
Yes, absolutely. Absolutely. Doesn't come out wet, they're doing something wrong.
Exactly. And if they go to physio, they are not going to come out wet. But it does mean that we do things slightly differently. So at the hydrotherapy pool, it'll be the hydrotherapist that's in charge of that treatment plan and doing the treatment as well. Often the owners will be sat on the side, they're not going to be in the pool. You know, it's much more hydrotherapist doing the job, and the owner watches and they go home and then they come back.
And again, it depends if they're in the treadmill. Again, you know, it is more land-based because you've got a bit of weight bearing because they're standing on the belt, whereas in the pool it's totally non-weight bearing. But either way, owners don't get involved. They can't, like, they might encourage their doggies, but they don't get involved as in whatever treatment. It is down to the hydrotherapist to do the right treatment for each individual doggie.
Absolutely. And we'll definitely come back to the treadmill because I was going to mention that in a moment. But yeah, whereas with the physio, it might be that the owner has to help, you know, keep the dog calm, laying on the floor while the physio does their massage or the range of movement work. Or, you know, the owner would also be, or certainly my cases, you know, my owners are taught how to do some exercises with their dogs at home, so that the physio goes on to the daily plan with the dogs at home. So they get a home plan. And I think, you know, that's definitely something we should just come circle back to as well, from a home treatment plan as well, because it is something where you get
homework. Again, it's another grey area.
But it's yeah, exactly. I mean, that's the other thing as well, is that we all work very differently, don't we? So, you know, I do have owners that come to me sometimes have seen other physios in the past when they've lived up in a different place and they've moved or whatever, you know, and what they come to you is completely different than what I might do and choose to do. Yeah. And so I'll say to them, I'll say, look, you know, we don't all work the same. We've all done different training. We've all done different CPDs. And so it keeps things quite different for, you know, each individual.
There's no real right and wrong. It's just that kind of everybody has a different view of how we're going to get the same kind of result. We might take the same different paths, but you end up at the same result. As long as you get to the same result and the idea is that doggy gets better, doesn't matter how you get there.
Exactly. And equally, you know, it's the same with veterinary practice. Again, you know, you could go to 8 different veterinary practices and 8 different ways of doing something. So this is not unusual. This is quite normal. So, I mean, for you watching, what we have to take from that is that you have to ask your questions and find out what it is that you want and how you want to work with your therapist to make the plan that you want for your dog's or cat's recovery.
And again, if the owner's not happy, because I know every hydrotherapy centre works different, and sometimes you have, like in all industries, good ones and bad ones. And if the owners aren't happy, they should ask the question or ask what training they've done and kind of like, why are you doing it that way? And so if they've got the correct training, they will be able to explain what they're doing and reassure the owner.
Absolutely. And that's one of the key questions, really, isn't it? Is, you know, is because all of our training's different and we all trained at different times, you know, and training is constantly evolving. Not one of us could sit and comment on every single training course out there because none of us have done them all. So we only know what we've done, right?
Exactly. Absolutely. Absolutely.
But it's a question that's worth asking, and, you know, making sure that you guys feel confident and comfortable with how the treatment plan is going to look for you and what it means moving forward, so that you are committed to the right plan that is right for you. I do want to just make sure I circle back to the treadmill and don't forget that, because obviously that is another thing as well, is that people don't often realise that there are different methods even within the hydrotherapy side. Sometimes there's a big giant pool, sometimes there's a small pool with jets, sometimes there's a treadmill, and the treadmills have water levels that go up and down. So that's a reason for that, because the body will be more supported, and also the challenge is different at the different leg heights. So, you know, it can all look very, very different. Do you have anything to add to that?
And again, there are some places where they literally have kind of more like a hot tub, so the dog just literally goes in for a spa. So again, it all depends on the condition you're treating, and kind of like sometimes it's the age of the dog. again, you've got to think of the program, because sometimes it's not all about working for long minutes, or my dog's run for 5 minutes. It's not about the length, it's about the quality and kind of what you're actually hoping to achieve. I've heard many a times they go, oh, my dog's went for 5 minutes. Yeah, but is that correct?
There you go. And that exact same thought process is what goes on from a physio point of view, because you're also looking at quality of movement. And Absolutely. So you want that. And then this is definitely where the Physio Hydro overlaps ultimately.
Oh God, yeah. Without a question. Hence why I combine the two, because it's just like, I'm biased, I know.
Exactly. But that's okay. Absolutely. Yeah. And I mean, honestly, we could say this about, like I said already, the vets have overlap with this as well. And equally, there's osteopaths, there's chiropractors. We're all quite similar, actually. Oh, yeah. But, we all have our slight differences on how we work. But that's even within that label. But actually, individually, me versus you, just how we work as a person is going to be that little bit different, isn't it?
Yeah, so absolutely, yeah.
Which is totally okay.
Yeah.
So there were some sort of questions that came up, so I was going to make sure that I asked them, just because again they're questions that owners have. But make sure, again, if you're watching, make sure that you ask any questions that you've got. This is not a problem. You can make sure that you ask away, and you've got Caroline here to answer as well. So one of the questions is, should I see both? What do you say about that?
Well, I think it depends on the condition. Sometimes, yes, you do need to see both, because sometimes you might be in an area where you have a hydrotherapist that only have a certain amount of level training, and they might need a physiotherapist. I do think physiotherapist has a place where the older dog is, because when their dog gets a certain age, hydrotherapy can be too strenuous. It's extremely strenuous. And even the treadmill, even though all the treadmill is slightly less strenuous and you can still get what you need to do, sometimes as they get older, just the journey to the hydrotherapy center can be too much. And then they're working the treadmill or the pool, whatever. So therefore, physiotherapy can then play a place, especially if you can get a physiotherapist to do home visits. So yes, I think there's a time and a place for both.
Absolutely, I completely agree. I mean, I've got several clients that are doing both hydro and physio, and I actively encourage it. And for me, it's definitely working as a team. And as a physio, I can feed back to the hydrotherapist, and a lot of them ask my opinion. Or what do you think of this? What do you think of that? And I can give my report back to them about what I'm seeing and what muscle deficits I'm feeling and what I think would be helpful to work on. But obviously they, as a hydrotherapist, know exactly what they're doing in the pool, so I would never try to interfere with that role. But it's really nice to hear from their point of view what the dog is able to manage and what they're noticing and stuff like that. So it works as a really great team, and there's different things to be achieved from both as well. So I mean, as you said, it's a really intense bit of exercise when you do that hydrotherapy.
Absolutely, yeah, absolutely.
Whereas
straight after surgery, you can't do hydrotherapy straight up. Yeah, you can't do hydrotherapy straight after surgery, because you can't get the stitches wet, and sometimes, depending on the vet, they don't like the dogs in water until at least 6 weeks post-op. So again, you've got that period where they need to do land-based exercise, massage, laser, all the physio stuff before they can do the hydro stuff. So again, there are times and places for both.
Absolutely. And that's exactly, a great point as well, is that we can tailor the physio to be more lenient on the sort of lower, the earlier stages post-op and stuff, to make sure that it's definitely safe enough for the patient and what their ability level is. And equally, like you say, when they're really, really old and they're really struggling, you need to get that fitness back up again really slowly, really carefully.
A really old dog that physically can't do it, why would you want to put that dog in a pool to even more strenuous exercise when he can't do the exercise already? You just can make him sore.
Yeah, so it's all about the individual case, isn't it? And working out what is right for that one individually. And as an owner, if you guys don't know, then ring us up, have a chat, and then help get the guidance.
Yeah,
and
easy.
Absolutely, everybody's going to be happy to to go through that with you. And equally, you know, some of the questions that came in were, you know, is there a benefit in doing both? Definitely, because the you know, from my point of view, the home exercise plan is fantastic, but then if you can do the hydro as well on top, it's like a boost of extra exercise, really works on them really well, and then the stuff you do at home in between just keeps it going that bit longer. So you know, which is, you know, absolutely fantastic. Do you have anything to add on that?
No, not really. I think it's bang on, because as hydrotherapists, I don't think they're trained in to do the home exercise. So therefore, working with a physio, you can the hydrotherapist can say, okay, right, so I've actually done this. I think you should be able, or might be able to do X, Y, and Z, and the physio can say, absolutely, I totally agree. I'll liaise with the client. They can do, I don't know, sit downs, leg downs, whatever. But again, that's a physio thing rather than a hydro thing. So the two actually combine really nicely.
Yeah, absolutely, absolutely. It is also well worth pointing out that there are a few other hydrotherapy pools out there with physios that are, you know, doing both. So, you know, don't panic if you have got a hydro that's saying loads of stuff and you're thinking, oh God, are they telling me physio stuff? They may actually be qualified in both and you may not know.
Yeah.
So it's worth asking the question and finding out, because then you know, and you know what you're getting. But there are not many physios that do hydro as well. There are just definitely not many, because
they're far and few between, that's for sure.
Yeah, well, it's very, very distinct learning, isn't it? You know, it's already a hard task to do one of them, let alone doing both of them. I mean, you know, and you're just crazy off the planet doing your osteo as well. I do know somebody who did a physio and then a chiropractor course as well, and I was like, really?
I don't think I could have done the two. It's bad enough doing the physio, and now I'm doing the osteo. Loving it, but my God, the osteo. I thought the physio was intense. The osteo is like, whoa.
It is mad.
Apparently year 2 gets even worse. Like, oh my God.
Oh, bless you. Don't think about it too hard. So other questions that came in. Just sorry, making sure I don't miss them. What if I can't afford both? Well, you know, oh, Caroline, you take that one.
Oh, that's a tricky one. If you can't afford both, again, I think it would come down to kind of like the condition and age of the dog, what you're looking to achieve. Would it benefit more from kind of like a physio, because a physio, you think of the training wise, they might have more stuff that they could offer the client, so therefore they could do more things at home to help support the doggy more. Hydrotherapy is brilliant. You've got to make sure you find the right hydrotherapy centre again, because they might have a physio on site, so they might turn around and say, okay, right, we'll just get the physio to pop in, see how it goes, and all that communication with the client. That's a tough one.
It is, but I also wanted to make sure we covered it, because I do know that that is something that people have concerned about, is obviously the financial side. And equally, the things that I would probably add to that are, you know, again, are you able to commit? Are you able to go to the pool every day? Not every day, obviously, for the right, you know, regime that they would encourage you to do. You know, for some people, it might be that they prefer being able to do a home exercise plan and being guided through that, and you know, that might work better for them. So I think it's not, it is completely about the animal, but it's not all about the animal. It could also be totally valid to justify your choice on what you're able to commit to at home, because if you're not able to commit to doing, you know, any home exercise plan, then maybe hydro is the best solution. You know, because at the end of the day, then at least they're getting the treatment that, you know, they need. You know, and on the flip side, maybe, you know, the home exercise plan does work better for you because you can't get out and drive to the hydro every week or whatever is required.
Again, you've also got to take in consideration. So I know some hydrotherapy centres do half an hour. I know some that do 45 minutes, and I know some that do an hour. So again, it all depends kind of like what time wise the owners have got as well. So they might be busy and they can only do, I don't know, half an hour slot, or they might only be able to travel to a certain amount of distance. So again, it's a tough call.
It is. But what hopefully this talk is doing is stimulating people to have the thoughts of questions in their mind. So the right questions to be able to ask the hydro or the physio, so that they can get the plan that they want to to be able to work together and move forwards, because it ultimately, it isn't a case of just handing your animal over and woo, there you go, you fix it for me. This is a team plan. This is a team plan. So it's all about making sure that everybody is just ticking the right boxes and feeling really good about the decisions they make and, you know, moving forwards. One question that came in was, my dog doesn't like water, so can he do hydrotherapy?
Absolutely, without a question of doubt. We have many dogs that don't particularly like water. You get reports that they walk around puddles. Again, it's all about the introduction. So I must admit, the treadmill is easier because you can get them used to the dry bout first, and then you can put a little bit so it just gets their toes wet, and then you can get the water deeper and deeper, so you have different heights. The pool is a bit more tricky because you literally have to go from kind of like in the pool because it's a big, oh my god, it's a big puddle. But yeah, as long as it's done gently, most dogs, the first session, no matter how even if they like swimming, the first session is the stressful one. And they do go, oh, what are you doing to me? But normally by the second time, they can't, yeah, this is easy. And by the third time, they can't like running in and jumping in the pool. So yeah. But even if they don't like it, most of them take to it.
I was saying, this is the same for physio as well. You know, the first session is always the stressful one. They don't know what you're doing, and then they're like, "Oh, this girl's touching me weird." I don't, like, you know, they're used to the vet kind of like pull, quick, chat, and then all of a sudden the physio's sort of trying to actually stroke them, and then they're suspicious sometimes. You know, so you know, so those same sort of nervousness can be there. I always think with the hydro, at least the water's warm. So that's
it is. But again, that depends on the pool, because I know some pools that are 28. Me personally, I wouldn't get in a pool at 28. It's cold.
I didn't even think of it like that. I must admit, I just assumed that it's always warm. But
I think they say the pools can vary between 28 and 32 now.
Oh wow!
If you ever got in a pool at 28, it's cold. It's cold.
Wow. Okay, so there's another question to ask, guys. What's the temperature of the water? You never know.
Absolutely.
But at the end of the day, 28 is still warmer than a puddle.
That is true. And it's still warm in the river.
Exactly. So another question was, you know, about cats and rabbits doing hydro and physio. I certainly treat tons of cats and rabbits for doing physio. How do they like the hydro as well?
I have never done a rabbit. In 18 years, I've never had a referral from a rabbit.
Oh, okay.
So I'm not quite sure. I can't see any reason why they can't. Personally, I might not do it because I'll be too worried about the stress levels with a rabbit.
Well done. I agree with that.
Absolutely. So it's like, oh, not too sure. Cats. I have done several cats in my lifetime. Again, they are challenging. Some take to it, some don't. The last one I done, he was just a dream. Started off very gentle. Again, introduced the water at home in the bath, and then we got bigger and bigger and bigger. And then he got to a certain age, and I thought, this is too stressful. And I actually put him in the treadmill, and he stormed the treadmill.
Wow.
So yeah, so cats can do it. Me personally, I wouldn't do a rabbit. I just think it's too stressful. I really do.
I do think that's very wise, actually. Yeah, because rabbits they don't handle stress well at all. So that's fair enough.
Cats, again, if you kind of think about doing hydrotherapy for a cat, see how it is in the bath. If it sits in the bath in water and it's just doesn't freak out or lash out, then yeah, give it a go. But it has to be done little stages, little bits. Otherwise, they just stress. Yeah.
Yeah, no, that is fair enough. So I think that might be all of the questions. Have we? Yeah, because we chatted a lot, so I think we've managed to cover almost most of it, really. Yeah, I think that's it. So did you have anything else that you would like to add for hydro versus physio?
Hydro versus physio. No, I think again, if your dog's kind of like looking for one, they can't phone round, because like you said, they're all different. And there are some centres where they do both. Some hydrotherapists are both, as in they're trained in both. So again, it's asking the question, but it does come down to kind of like, I think cost sometimes comes into it, especially at the moment. But yeah, no. And
So
again, I kind of the vets seem to kind of ask a lot of treadmill work these days rather than pull work. Why, I don't know. The treadmills do seem to be kind of like, oh yeah, treadmill, treadmill, treadmill. Doesn't always need to be the treadmill. So again, ask the question. Absolutely. You know, I get referrals to my little centre, and again, the vet say, "Oh, I don't want the treadmill. I need a treadmill." Ask the question. That's all I would say.
No, definitely. I mean, I'm not a hydrotherapist and I never would claim to be, but even I've done some training that has actually said, look, in these situations, a pool is better, and in these situations, treadmill's better, but very much pointing out that there is a difference. And so you need to be, you need a hydro that understands that. And they certainly should do if they've got both as well anyway.
Absolutely.
And even if they don't have both, they should understand the limitations. So, which is totally fair enough, because obviously it is expensive to have both, so it's not unreasonable.
It is, and it is. The other thing I was kind of just, I don't know if it's right or not, but they get some hydrotherapy centres and they need it weekly. But again, ask the questions. You start off weekly, probably like with the physio, but you don't always have to keep to weekly. Like the physio, sometimes you do physio once a month. Hydrotherapy is no different. Again, you can kind of like go to once a month. It's again, it depends on circumstances, conditions, but it doesn't always have to be weekly.
Yeah, no, that's a really good point. So, I mean, in conclusion, everybody, I think that basically what we have to hear from all of this is ask questions, ask questions, ask questions. Hydro and physio are most definitely not the same, but we do have a lot of overlap. So that is understandable that there might be some confusion as to what is the difference. But you are going to get different things from both. You're going to get homework from your physio, hopefully. You will from me. And, you know, they are just different ways of achieving the same thing. They are trying to achieve the same thing. They are aiming at pain control, and they're aiming at muscle building and better range of movement and all that sort of thing. But we all know there's different ways to achieve many things in life. And this is one of those things. And it's impossible to guess which is going to be better for your animal's situation. But, you know, from just an outward title, but in asking the questions, we can help formulate a plan for you. So, you know, whatever your thoughts are, just have a phone call. Everybody will be more than happy to take that phone call, and then answer any questions that you've got, and then help you make a decision about what your plan should look like for your situation, because they are always different. And every single dog with, you know, they may have had the same surgery, the same cruciate. It doesn't mean that they get treated in the same way, and the outcome is not always the same. If it was, it would be amazing, because the vets would all do the same surgery, and they would all tell you that by 10 it will look like this, and by day 20 it will look like that, and there will be zero failed surgery. And we don't have that situation, do we?
No, and definitely not. Definitely not.
Exactly. And that's why this is so complicated. But this is such a, you know, I just find it such a fun subject at the same time, because I just think it's so cool how we can have such complicated bodies that nothing can be on this. Because I think we're so used to these days, you know, everything is like we do X, Y, Z and we get, you know, this. And actually, bodies and biology don't do that, do they?
No, they definitely don't do that. No.
No,
and again, when you put age in the equation as well, they definitely don't do it.
Absolutely. And personality and, you know, all those things. So, yeah, there's so many things that keep this so complicated. And, you know, but one thing I do want to say is teamwork, guys, teamwork, 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 and teamwork again. And multimodal approach.
Absolutely.
Multimodal approach. You know, that means doing lots of different things is generally the best answer to get the best outcome. There is no one thing that can fix
it. There isn't no one thing, no.
Exactly. And Michael, thank you so much. He has just said great discussion topic. So
yay, good stuff.
So yes, I hope you've all enjoyed watching. Caroline, thank you so much for coming and joining us.
Very welcome.
I'm thrilled, and it's so lovely to see you again. So
yes.
Anyway, take care. Thanks for watching, everybody. Bye-bye.
Bye.